I'm Malcolm Hebden, but a lot of people will know me from playing Nosy Norris in the cabin in Coronation Street, which I've done for many years now. I've been very lucky, really. I mean, I'm getting on now, late 70s, but I've not had to call on the National Health Service or the hospitals very much apart from this latest episode, which came like a bolt from the blue. I didn't know I had a heart problem, and it turned out to be a serious heart problem, not anything that could be cured by a stent, or which ended up with me actually being in Blackpool Hospital unconscious for 3 weeks, and the overall period took about 3 months. It did come out of the blue. I didn't feel well, went to the local doctor. She did some tests, she was very diligent, did the tests, and rang me here, more or less where I'm sitting now, to tell me I'd had at least one heart attack and probably more. The treatment I had there was exemplary. It was just wonderful. Well, I mean, of course it was. They saved my life. You can't ask for more than that. There was one occasion after the operation they didn't think I'd make it till the morning, and they all gathered round the bed. Apparently, I would have been very worried if I'd woken up, but to see them all staring at me like that. And that went on, but they were allowed to visit when they wanted. They could ring up. I mean, because some of them, one of the girls lives in Leeds, one lives in St Albans, another one lives here in the Ribble Valley, and they could ring at any time, which was so comforting to them. And the attention, and they thought the nurses, I'm sorry I missed them. I'm sure I'd have been terribly impressed. And Mr. Zachariah, who did the operation, and his team were just excellent. And they did their best. They said, we've done our best, but we don't know. But they did better than the best. I'm still here. They have to do very personal things for you, which I find, and they just said, just close your eyes and think of something else. They were terrific. I have no complaints at all. And when I think about it, I can't think of anything that they could have improved on. All the nurses were treating everybody. I used to leave the door open and watch the night nurses at the station there, their desk, still working. I mean, they do have to do very, very personal things for you. But it's not a problem to them, but it is a problem to the patient, I think. But I asked one of the girls, why do you do this, you know, at washing old men like me and things? And she said, it's called caring. And they were fab. No complaints at all. The food was a bit of a problem because they damaged my swallowing mechanism with tubes and things. And therefore I had to have food that looked like it had been pre-chewed. It was pulverised, what's the word? Liquidised. So I did lose quite a bit of weight, which again, another plus. And I did develop relationships and find out a lot about some of the nurses' past and things. You know, we used to talk through the night, and to most people I'll talk to anybody. It was almost fun. Not quite, but almost. I think the trouble is with National Health, they're under enormous pressure, both financially and staffing. It is more of a working sort of hospital. People come and go more frequently, but I've no complaints, none at all. It still remains, as I say, an example to the rest of the world.
Hello, my name's Carol. I'm the ward manager of the Cardiac Intensive Care Unit. I've seen your video, Malcolm, and I was really pleased with the comments you made about when you were in CITU, and I will make sure all the staff see this video. It will help encourage them to improve our service, and I think they will be very grateful for what you've said about them. Thank you.
Hi Malcolm, I'm Luke. I'm a charge nurse on Cardiac ITU. It was a pleasure looking after you. I'm really pleased you're doing so well and you're back home, and thanks again for all your lovely comments.